Hello, good evening, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam. This is a special focus on coronavirus pandemic 2020. This is a world news brought to you from Houston, Texas. The topic of focus today is New York City. Is New York healthcare system at crossroads? We're going to look at using a model such as this one. But before I delve into this particular model, I just want to give you the source of this model so you can visit their website and check it for yourself. This was produced by covidactnow.org, comprising of experts in the healthcare industry and also in the epidemiology field, along with some ex-tech company experts. And here are some of the disclaimers as far as this model is concerned. You can pause the video and look at each one of these disclaimers. So let us get back to the graph and see where we are today, what we need to do, and where do we expect to be in the coming weeks based on this particular model. And whatever I'm going to say is going to be based on this model. You may or may not agree with the model, but it gives you a general direction of what to expect in the coming weeks. First of all, here we have on the vertical axis number of hospitalizations ranging from 0 to 500,000. On the horizontal axis, we have the time frame going from March 16th all the way up to June 22nd. At the bottom, you see this black line which represents the hospital capacity of New York City at this time and what the increased demand is going to be like at the peak of this pandemic in New York City, and then what are the demands that are going to be put on this in the coming weeks and months. At the present time, New York City has approximately 22,000 beds, which are barely able to meet the demands of this coronavirus epidemic as of March 30, 2000. The pink represents the number of admissions and the demand that is placed on the healthcare system if we had no intervention whatsoever. So that is not the case. So let's put this aside, but it is important to keep this in mind and when I come back to see where exactly do we fit in this particular graph at the present time and in the future. The other graph I would like to focus is the orange graph, which represents the demand on the healthcare system in terms of a number of hospitalizations if we were to implement social distancing. We have implemented the social distancing, and we do expect to see some benefit from that, along with increased healthcare supplies, which are barely meeting the needs of yesterday and today. If we had followed at the beginning of this epidemic, the Wuhan style of 3 months of lockdown, then we would have seen this cyan color graph, which is barely visible here, and that would have been met by the hospital bed capacity to handle the number of cases. Well, this is already behind us. We haven't implemented the Wuhan style of lockdown. So let's move on to the next option, which is 3 months of shelter in place. If we had implemented 3 months of shelter in place, then we're going to see this light blue color graph, which is seen here just below the hospital capacity and demand line. And as you can see, the hospital bed capacity has to be increased to almost 35,000 from 22,000 in the next 30 days to meet the increased demand produced by shelter in place. If we didn't follow the shelter in place, and if we just had implemented 3 months of social distancing, and this is what would have been the demand on the healthcare system, requiring almost 150 to 180,000 hospitalizations to provide the healthcare. Of course, it was a little late, but nonetheless, if the shelter in place is continued for several weeks, we still need hospitalization capacity of 35,000, and this would continue to grow as time lapses because of continued stay in the hospital. So this sort of explains as to what is happening in New York City at the present time and what shelter in place can do in terms of reducing the demand on the healthcare system, but still we have to increase the hospital capacity to meet this increase in the number of admissions to the hospital. Now, in the next slide, we are going to summarize what we have been talking about. Obviously, no action is not the option for us. Again, 3 months of social distancing. Some of this was done in the last week or two. So it is going to have some impact on the number of patients admitted to the hospital. But if even by following 3 months of shelter in place, they expect the death rate to be close to 50,000. And obviously, we are not going to be able to do this one. So we could be looking at, with continued shelter in place, an estimated death count of 50,000. Of course, this is just based on this theoretical model, and the reality on the ground can be different. With drastic measures in people movement, along with increased healthcare resources and hospital beds, we may be able to, we may be able to reduce the number of admissions, number of deaths, and certainly by isolating those people who have coronavirus from the rest of the group, we hopefully would see that we won't be reaching this particular number. As one more point I would like to emphasize is the time to have implemented 3 months of shelter in place. The window of opportunity was between March 13 and March 18th. Today it is March 22nd, and the shelter in place has been introduced in the last few days. So we probably have lost approximately several days in this cycle to be able to drastically reduce the number of admissions to the hospital and drastically reduce the number of deaths related to the coronavirus epidemic. Ladies and gentlemen, thank you so much for watching this presentation. I am sure you are going to have a lot of questions about this particular model. And please do leave your comments below, and please do subscribe to our YouTube channel, and we will see you next time.